Good morning, everyone. My name is Abdulhamid. I work as a health settlement worker, and today I will present to you an information session from the Multicultural Association of Fredericton about healthcare system in Canada and New Brunswick. If you are a Canadian citizen or a permanent resident or temporary foreign worker or international student, you can apply for public health insurance, which cover most of the health care services. Each province has their own health insurance plan. When you have a permanent accommodation in New Brunswick and you have a permanent address, you can apply for the Medicare coverage. You can do this in the Office of Service New Brunswick. You will receive the Medicare card, which is shown in the slide, and you must present this Medicare card when you access any health services. What are the services which are covered by the Medicare plan? Visit to healthcare provider, necessary medical procedure, hospital services such as admission, operation, blood test, X-ray, and delivery. What are the services which are not covered by the Medicare plan? Drugs or medication. So if you need drugs or medication for treatment of your health, it will not be covered by the Medicare plan, and you will need another health insurance plan to cover their cost. Ambulance service, vision care, dental care are not covered by the Medicare plan. Cosmetic procedure such as removal of skin mole, circumcision if you need to do it for newborn for religious cause, it will not be covered. But if it is indicated due to health related cause, it will be covered. Complete medical examination as a part of annual checkup will not be covered. Examination, immunization services at the request of a third party for the purpose of employment, travel, immigration insurance also will not be covered. Now we will talk about Interim Federal Health IFH program. It is a limited and temporary health insurance from the federal government. It is issued for the refugee on arrival to Canada. It covers the period before the Medicare plan coverage start, and it covers only for 1 year from the date of arrival to Canada. What are the services which are covered by the IFH insurance? Prescription drug, hospital services, services from medical doctor, registered nurses, other healthcare professionals, include pre- and postnatal care for pregnant women, laboratory test, diagnostic, X-rays, ambulance service. All these are covered by the IFH plan. What else covered by the IFH plan? Vision care, dental care, services such as psychologist, occupational therapist, physiotherapist appointment. If you need assistive device or medical supplies such as orthopedic equipment, hearing aid, diabetic supplies, it can be covered by the IFH plan. And now I will talk about the healthcare provider system in Canada. In Canada, we have primary health care provider and we have a specialist doctor. Primary health care provider include registered nurse, nurse practitioner, and family doctor. Most of the health services will be done by the primary health care provider. And if the primary health care provider think that your condition need a referral to a specialist doctor, they will refer you to a specialist doctor. And in the specialist doctor group, we have many types of specialists, depend on the field of expertise. For example, if you have problem in your joint or bone, you will be referred to orthopedic specialist. You cannot have appointment with a specialist doctor without referral from primary health care provider. In Canada, you will need to be registered with a family doctor, and we will talk about how to register for a family doctor later. But if you need any health services and you don't have a family doctor, what you can do? There is many clinic, they call them after-hour clinic or walk-in clinics, and this clinic have a family doctor who can serve you till you have your own family doctor. The operating system in this clinic as follows. They serve patient on first come, first serve basis. This means that they have limited number of patients they can see every day. And if they receive this number, they stop taking new patient. They require you to register for appointment. Family doctors in this clinic do not have any idea about your health history. So if you have any health problem, such as high blood pressure, high blood sugar, you're taking any drugs, you're having any allergy, you need to inform them about your health history. The operating system in this clinic used to be you go to the clinic and they see you in person. But currently we have something called COVID-19 pandemic, which I will mention a bit later. And to reduce the chance of people getting this infection and to reduce the spread of this infection, this clinic now operate in different way. So what is the current operating system in this clinic? You need to call the clinic, and the secretary in the clinic will ask you for your contact information, your Medicare number, and your complaint. What is your problem? Then later the doctor will call you back and either give you treatment over the phone or order some blood tests or x-rays for you or ask you to come to the clinic to see you. In the next few slides, I will give you some information about after hours and walk-in clinics which are available in Fredericton area. The first one, temporary Fredericton after hour clinic. It operates from Monday to Friday from 1 p.m. to 8 p.m. and on Saturday from 1 p.m. to 5 p.m. To book appointment, you need to call them on 506-474-4633. Calls will be answered from 10 a.m. from Monday to Saturday. The clinic location, the Daily Gleaner building in Prospect Street. Another clinic in the North area, Brookside Mall Walk-in Clinic. It operates from Monday to Friday from 7 a.m. to 12 p.m. To book appointment, you need to call 506-447-9993, and it is located in Brookside Drive, Unit 2. Another clinic, New Maryland After Hour Clinic. It operates from Monday to Friday, 4 p.m. to 9 p.m. To book an appointment, you need to call 506-458-8927, and it is located in New Maryland. Another clinic in the North area, Marysville Walk-in Clinic. It operates from Monday to Friday from 8 a.m. till 12 p.m. The clinic location in Canada Street, and to book appointment, call the number 506-449-1653. In the beginning, we can help you to get access to this clinic and we can show you the system how to register for appointment there, and also we can help for interpretation if the client they cannot communicate in English or French. So the only thing you need to do, you need to contact your case manager and they can help you in booking and arranging services in this clinic. In the next few slides, I will give you some information about different type of clinics. These clinics are not walk-in clinic. This means you need to be registered with healthcare provider, and this healthcare provider will give you appointment to access service in this clinic. The first one, Fredericton Downtown Community Health Center. This clinic, it has a care team made of family doctor, nurse practitioner, registered dietitian, social worker, respiratory therapists. They provide wide range of diagnostic and support services and community services. They are located in King Street. Their phone number 506-452-5900. Their operating hour Monday to Thursday from 8 a.m. to 8 p.m. and on Friday from 8:30 to 6:30. Another clinic, Gibson Health Center. It has also a care team made of physician, nurse practitioner, social worker, registered dietitian, respiratory therapist, diabetic nurse, and also they offer educational session for healthy lifestyle. They are located in the north area in Brookside Drive, and their phone 506-447-4444. They operating from Monday to Friday 8:30 to 4:30. Another clinic, Noreen Richard Health Center. The primary health care services there focus mainly on the minority of Francophone residents in Fredericton. And by Francophone resident mean the people who speak mainly French. The team there consists of physician, nurse practitioner, social worker, dietitian, and respiratory therapist. The team work actively within the community and provide health-related educational sessions. They are located in Brisbane Street. Their phone 506-474-4611. The operating hour Monday to Friday from 8 a.m. to 4 p.m. and they have some evening appointment on Tuesday and Thursday. Another health services, Fredericton Addiction and Mental Health Service. They provide health services for mental health issues such as addiction treatment, counseling service, therapeutic group. And their location in Brunswick Street, their phone 506-453-2132. And operating hour from Monday to Friday 8:15 to 4:30. And to be registered there, you need to go and they do intake for you. So they take your medical information, your Medicare card number, your contact information, and they ask you about your health issues. And they will put you in waiting list and you will be seen according to the urgency of your health issues. Another clinic, Fredericton Public Health Clinic. Health services in this clinic include promoting a healthy lifestyle and healthy families through educational sessions, environmental protection, prevention, management, and control of communicable disease. And by communicable disease, we mean disease which can spread in the community, such as tuberculosis. They are located in 300 St. Mary, Suite 1200. Their phone 506-453-5200. Operating hour Monday to Friday from 8:30 to 4:30. Sexual health services are offered at the local community health center for all clients of all ages. And the health services include sexual health counseling, sexually transmitted disease infection testing, HIV testing available in some location, birth control, emergency contraception, pregnancy testing, pregnancy option counseling, cervical cancer screening. And these services can be accessed in Downtown Community Health Center, Gibson Health Center, Gibson Satellite Clinic, and Noreen Richard Clinic. So all these clinics provide sexual health services. Another important health topic is immunization. Immunization is the best way to keep you safe from many serious and potentially deadly disease. When a lot of people get vaccination or immunization, it can help to protect a community from spread of infectious disease, and this is known as herd immunity. You can get your immunization in Fredericton Public Health Clinic or in any clinic through your health care provider. Public Health Clinic provides the following services. They administer vaccine for free to those eligible based on the province criteria. They give advice on immunization. They monitor immunization requirement for children in the daycare and in the school. And they record and report adverse event of immunization. Now I will give you some information about hospital service. The first hospital, Dr. Everett Chalmers Regional Hospital. It is located in the city of Fredericton, and it provides wide range of health services. It has an emergency room, ER, for treatment of people with emergency health problem or accident. It is located in Brisman Street, and the phone number 506-452-5400. It operates 24 hours daily, 7 days a week, including weekends and public holiday. If you need a medical appointment at the hospital, you will receive a letter at your home address with the date, time, and any special requirement for your test. You need to take this letter with your Medicare card and you go for the medical appointment. The result of the test will be sent back to your healthcare provider and they will inform you about the result. Another hospital, Oromocto Public Hospital. This hospital has inpatient family practice, palliative care, rehabilitation service. They have surgical center, a screening program for cancer, breast, and other cancer, and they have emergency department. They are located in Oromocto. Their phone 506-357-4700. Operating hour, the emergency department from 8 a.m. till 10 p.m. daily. I mentioned that in the hospital they have emergency room and you can go there for treatment of emergency health situation. Emergencies are confusing. It is not always clear when to call for help. For any emergency, you can call the number 911. When you call 911, you will be connected with the police, ambulance service, and fire department. If you have any health emergency and you're not sure what to do, you can call another number, 811. Example of health emergencies: heart attack, asthma, severe allergy, bleeding from cut wound, drink poison, choking, broken bones. All these considered as health emergency, and you can go to the emergency room in the hospital for treatment of this condition. Now I will give you some information about pharmacy, the place where you can get your drugs or medication. Drugs include two groups: prescription drug and over-the-counter drug. For prescription drugs, you need prescription from the doctor to get these drugs. To buy these drugs from the pharmacy, you need to go there and you take with you the Medicare card, your doctor prescription, and any health insurance plan to cover the cost of the drug. For over-the-counter drugs, you don't need a prescription from the doctor. Pharmacists can help you to get these drugs. They are not covered usually by the health insurance plans, and you need to pay for the cost of these drugs. Now I will give you some information about New Brunswick telecare service. This telecare service is a free confidential health advice and information line. When you dial 811 number, you will have access to bilingual registered nurse 24 hours a day, 7 days a week, and they can provide the service in French and in English. A receptionist will take your name, your contact information, and a nurse will call you back. You can mention your health issue to them and they will tell you what to do. I mentioned before that you need to register to have a family doctor. So after you settle and you have a permanent address and Medicare plan, you need to register for primary health care provider. And you can do this by dialing the number 811, or you can fill the registration form which is available online using the website shown in the screen. So they will take your information, they will put your name in waiting list, and when there is a available family doctor, they will register you with this family doctor. I mentioned before that currently we have what we call a COVID-19 pandemic. What we mean by COVID-19 pandemic, it is a viral infection which is spread in many countries all over the world. People who get infected with this virus, they can have no symptoms, but also they can have one or more of the following symptoms. They can have fever, cough, sore throat, running nose, headache, fatigue, muscle pain, diarrhea, loss of taste, loss of smell. In children, they can have purple marking on the fingers and toes. To reduce the spread of this virus, there is few measures you can practice. Practice physical distancing, wash your hand frequently, use cough and sneeze etiquette, avoid touching your face with unwashed hand, stay home if you're feeling ill, clean and disinfect surfaces and objects you use, stay home if you have a serious illness like heart disease or lung disease, limit non-essential travel. By doing these measures, we are lowering the spread of the viral infections. So the simplest thing you can do is frequent hand washing. And you can do your hand washing using warm water and soap, and you need to rub your hand for at least 20 seconds. And if you don't have access to soap and water, you can use hand sanitizer with at least 60% alcohol, and also you rub it in your hand for about 20 seconds. Cough etiquette. If you cough or sneeze, always cover your nose and mouth with tissue, or use your sleeve. If you use any tissues, you need to discard them immediately after use. And you need to wash your hand after you're coughing or sneezing to get rid of any virus in your hand. Another thing you can practice, always practice physical or social distancing. And by this we mean you avoid crowded places, reduce non-essential travel and trips out of your homes. If you're outside, try to keep 2 meters away from others. Always commute outside the busiest hour of the day if you're planning to use public transport. Avoid greeting, which include physical contact like handshake. What else you can do? Wear a mask. So if you are ill, and you will be in close contact with others, you need to wear a mask. Also, wear a mask if it is not possible to maintain the 2-meter distance between you and other when you go outside, like shopping areas. If medical mask it is not available, you can wear non-medical mask or close face covering. What you can do if you think you might have COVID-19 infection. You can use the self-assessment tool which is available online to help you to know if you need to be tested for COVID-19 infection or not. You can complete this assessment for yourself or on behalf of someone else if they are not able to do it. Also, you can call 811 number. You can mention your symptom and they will provide you with advice on what you can do. Before we reach the end of this information session, I would like to mention that the government of New Brunswick provide and offer their services in both official language, English and French. And also most of the health services in the province, you can access it in French and English. And most of the Horizon services, there is over the phone interpretation service which can help you in interpretation. In the Multicultural Association, we have 60 staff who can speak 40 different languages. And also we have culture broker who speak additional 23 languages. This means that you can access a lot of services in your first language, which definitely will be a big difference to you. We reached to the end of this information session. I hope it was useful information for everyone, and thank you and stay healthy and safe.